when it comes to the lumbar intervertebral disc prolapse, this is a condition where the spongy material which is present in between the two bones in the lower spine, the disc slowly, when it's started to degenerate, it becomes weak. Hello everybody, Namaste. I am Dr. Subodh Shetty, spine surgeon in Apollo Spectra Hospitals, and today I would like to cover a few topics in spine. Commonly, the most common problem in spine we all encounter is the lower back pain, which is due to various causes like intervertebral disc prolapse, the spondylodiscitis, the spondylolisthesis, lumbar canal stenosis like problems, and in the elderly it could be degenerated, the deformities happening in the lumbar region, and so is true with the neck part of the spine where they suffer from cervical spondylosis due to the wear and tear happening in the neck region as well. These are some of the few common causes. And when it comes to the lumbar intervertebral disc prolapse, this is a condition where the spongy material which is present in between the two bones in the lower spine, particularly at the fourth and the fifth and the spinal, the sacral region, the disc slowly, when it's started to degenerate, it becomes weak, and one day due to some untoward incidents like sudden jerk or sudden lifting of weights, there could be a disc coming out, and once it comes out there will be acute severe back pain which can further result in pain coming down the legs due to the pressure on the nerves. So this pain could be just in the form of pain and numbness, but if the pressure on the nerve is too much, then there could be weakness in the foot and the leg part of the region. So often these type of conditions can be treated with medicine, rest and some injections, but if the recovery from neurological deficit cannot be seen within few weeks, surgery would be recommended for faster recovery and as a complete solution to the problem. This here in Apollo Spectra, I do it with minimally invasive technique with the microlumbar, what we call as microlumbar discectomy. Secondly, the commonest problem related to the lower back is spondylolisthesis, where the condition, you see the bone slips one over the other. It can be over a period of time, or it could be seen in younger children in their adolescence, which we call as dysplastic or lytic type of listhesis. Often they develop what we call as neurogenic claudication because of the overall canal size reducing, and when they walk after a few distance they are unable to walk due to numbness in both the legs and severe backache, and bending and walking could be a problem. In these conditions, when the bone slips one over the other, then there is instability in the area and you may have to stabilize the spine if the recovery does not happen with back strengthening exercises. The stabilization requires surgery where the spine is fixed with the rod and screws so that the spine which is unstable is stabilized and it becomes a permanent solution to overcome the problem of neurological problems. In the neck again, it is the neck degeneration happening in the disc area, and we often see in our crowd in a city like Bengaluru, due to the pattern of work in our software engineers, in the people working in the bank, and often we see in people with over usage of phones. Slowly the muscles become weak in the neck and they'll end up with very stiff neck. Often we can overcome this problem, but later on if the disc collapses and they get numbness in the upper limbs, they may have to undergo surgery in the form of anterior cervical discectomy and fusion. These are few things which we commonly encounter in our crowd in Bangalore. So this is a few tips what I have tried to give, and I would end with the suggestion that to overcome all these problems, ideally you better have a proper lifestyle, avoid smoking, regular exercises and regular diet, putting you in a long way, and please take care of yourself. Thank you.